platform that we're using today. So let me now hand over to the Acting Director of the Africa CDC, Dr. Ogwell, for his briefing today. Dr. Ogwell, it's over to you.
Thank you. Thank you very much where you're joining us from. And again, apologies for the delayed start. So today, I'll take you through the COVID situation, again, in an abridged version. And then we'll also speak about other key public health events. So beginning with COVID, the epidemiological update for this week, we see that the total number of cases that we've documented so far is 12 million, which is about 2% of the total cases being reported globally so far. Our recoveries are at 11.4 million, which is 95% of the total numbers reported here on the continent. The number of deaths is 255,000, which gives us a case fatality rate cumulatively of 2.1%. And when we look a little bit closely at the case fatality rate, we see that only in a case. When we look at the latest data, no country has reported any new wave. This is a good situation for the continent. And in fact, when we look at the variants of concern, again, no new variants have been reported by any country on the continent. A relatively stable situation over the last many weeks. When we look at the trend analysis for the last 1 week, that is epidemiological week 38, which ran from the 19th to the 25th of September, and we compare it with the previous week 37, we see that the number of new cases during this last week, which is a 33% decrease when we compare it to AP week 37. Again, this is a good reflection, transmitting at any higher rate than we've seen over the last several weeks. And when we look at the number of deaths, similarly, we have documented only 17 new deaths across the continent, which is a 61% decrease when we compare to the previous week. The 4-week analysis, which will be the 4 weeks running from 29th of August to 25th of September, we see that the number of new cases have also dropped. We are seeing a 5% average decrease of new cases being reported. We are also seeing that the number of new deaths have also dropped by 15 average decrease. All these are good numbers, which shows us that, again, the effect of the pandemic is not increasing. It is more or less stabilized. Within the continent. When you look at tests, million COVID-19 tests across our 55 member states, and 130,957 new tests were reported to have been done, which is a 5% decrease from the previous week 37. When we look at positivity rates during this AP week 38, the positivity rate is 4%, and the test per case ratio is 26, which is a 30% decrease in the positivity rate and a 43% increase in the test per case ratio. Only 2 countries are reporting a test positivity rate that is higher than 12% for this week. On vaccination, to date, we have received 971 million doses of COVID-19 vaccines in 54 member states. We have administered 689 million, which corresponds to 71% of the total supply, and coverage has marginally gone up to 22.3% of the total population. We are also tracking booster doses, and to date, 2.7% have had their boosters. When we look at the deliveries by the AVAT mechanism, so far, we have cumulatively, as of the 28th of September, delivered 84.7 million doses of Johnson & Johnson vaccines, the latest being the 1 million doses delivered to Sudan during last week. And we continue to deliver the doses based on consumption and the needs that our member states are sending to us. Now, let's move to the other public health events, and these are quite important progress across the continent. First is the very good announcement last week that the Ebola outbreak in the DRC, that particular outbreak has been called off as closed because there are no more new cases, and all those that have been affected have received the necessary clearances having gone through the emergency treatment units there. So as a public health event, the Ebola outbreak in DRC is now closed. In 5 significant public health outbreaks at the moment, and these are the Ebola outbreak in Uganda, monkeypox in multiple countries, the Rift Valley fever in Mauritania, the Crimean Congo, and the multi-country cholera outbreak. And I'll give you a little bit of update on these 5. Significance is, of course, established the emergency operations